Nigeria's Borno state is currently home to over 2 million internally displaced persons, many of whom rely almost entirely on humanitarian support for food, healthcare, clean water and basic shelter. But recent funding cuts have forced several aid agencies to scale down, or in some cases suspend critical life-saving services. Food distribution has declined sharply. Nutrition programs for children and pregnant women have been disrupted, and access to healthcare and safe drinking water is becoming increasingly limited across displacement camps and host communities in Maiduguri and surrounding local government areas. 32-year-old Algoni Ladan, a father of 6 and an internally displaced person, says the withdrawal of aid has pushed his household into severe hardship. According to him, insecurity restricts men from freely accessing farms and markets for fear of attacks, leaving women to shoulder the burden of survival.
We no longer receive any support from humanitarian organizations. In the past, they provided us with food, clean water, detergents, mosquito nets and sleeping mats. But now all assistance has stopped. As a result, we are facing severe hardship while insecurity continues to threaten our community because insurgents are operating very close to where we live.
The situation is equally stark for Yakura Menene, a 28-year-old widow.
We do not have enough food, and violence continues to claim lives in our community. My husband is dead, and just 2 days ago, 2 children from my husband's family were killed while in the bush. Women are now the ones going to gather firewood, but I am heavily pregnant and no longer strong enough to make that journey. The 2 children who were killed had gone to cut firewood so that we could sell it and have something to eat. As I speak, I have not eaten since morning. There is nothing in the house to cook, and I am expecting a child.
Humanitarian experts have warned that the continued funding gaps brought on by withdrawal of funding agencies like USAID could lead to increased malnutrition, preventable illnesses, and heightened protection risk, especially among children and vulnerable groups. The one that without sustained support, the humanitarian situation in Borno State could deteriorate rapidly.
The impact of the withdrawal of the USAID really significantly affected some services, particularly in relation to those that are internally displaced. There are specific services provided by NGOs that entirely depended on the USAID as their donors to partake in the particular intervention to assist the people. So the paucity of resources led to the closure of many of these organizations.
The humanitarian funding is shrinking significantly, and we have seen it that year by year the amount of money we are able to mobilize is now declining. But I'm having hope. I'm having hope because with the Minister of Humanitarian Affairs, we are looking for possibility of domestic resource mobilization, but we are also calling our partner not to turn their back to the people who need humanitarian assistance.
For now, Algoni and others like him are hoping the funding situation improves very quickly. If not, their conditions can only get worse from this point. Deji Bademasi, CGTN, Maiduguri, Nigeria.